I'm Dr. Jen, and this is Nurse Julija. I'm here to introduce her today because she is one of my community partners and part of our team. Nurse Julija, obviously, as the name suggests, graduated with her nursing degree, but has recently become one of the first board-certified nurse coaches. I'm going to let Julija explain a little bit more about what nurse coaching is, and then we'll go on and explain how that integrates with naturopathic medicine and chiropractic medicine to create a more fulfilled
Dr. Jen and I have known
treatment
each other for over 5 years now. We used to work together at a chiropractic clinic, and it was a really good experience. I got to learn a lot there from Dr. Jen because her and I had very similar views on health. I, at the time, was studying for nursing school. She was studying to be a chiropractor and getting her clinical hours in, and I always thought it'd be so cool to work in a naturopathic scene as a nurse, but didn't know how. So when I was in school, I was still really struggling at the time. So I'm really happy that my experience has led me to nurse coaching and that certification program like this does exist, because I think it's a really revolutionary way to change healthcare.
It's a really good bridge too,
Mm-hmm.
It kind of combines both of it,
Mm-hmm.
It's the more holistic version of nursing,
Mm-hmm.
which has not been, I think this is the first thing,
Yep.
right? That's
Yep.
kind of come along
Mm-hmm.
there. I love that it's board certified and everything.
Yep.
But yeah, because when you first went into nursing school
Mm-hmm.
and I got the call oh, I graduated from nursing school, I was like, ooh, nursing school. That was an interesting choice for Julija because you were just always so into yoga and essential oils and supplements and hands-on touch and with the patients that you would interact with in Dr. Williams' office, love you, that you were always just so intentional with them and so, it was such a personalized interaction. Knew everybody's name by, knew what their dog was doing, pets, kids, or whatever. You knew everything about their car broke down and blah, blah, blah. And, then I just didn't see how that part of you was going to shine in nursing, but what's done is done, right? And I get it. I went into traditional medical school. I got my MD/MS before I decided not to continue with the MD and just graduate with my MS. And it took me a minute to find naturopathic medicine because I just was a niche that I was what? This is not it. This is not it for me. There's more to this than unfortunately, I don't want to downplay normal medicine, and I'm not, because I really rely on them for a lot and we work together very well, but there just has to be something to kind of work in the background and kind of do these interventions for things that either aren't that serious or where surgery and medication don't fit in, and stuff that needs more one-on-one attention, these chronic illnesses that have kind of insidiously gotten worse and worse for a lot of patients. They really need somebody to undo a lot of what's been done, and they need their hand holding in that. They also need someone to take the time to investigate, and I think, and then somebody to really tailor their treatment to them, and then handle how they're going to struggle with that, because that's the beauty of, I think, both nurse coaching and naturopathic medicine is it's just so individualized. Every time I talk to a person, I don't care if you both have the same disease, your treatment plans are radically different because you're going to struggle with it. I have one patient who struggles with, the dairy. We'll say, example, Hashimoto's disease, treated all the time, right? Very successfully, and with the same basic protocols, right? The whys of why we treat it. We want to get rid of that, gut inflammation. We want to treat the gut. We want to make sure that the immune system is tapered down and chilled out quite a bit. We want to make sure what's intaking isn't making things worse, and that we're settling a lot of those hormones out, right? And making sure those biochemical processes are supported. So that is all going to happen with every Hashimoto's patient. However, there's people who are going to struggle with different parts of the diet. There's people who are going to struggle with different parts of taking their supplements. There's people who are going to struggle with not drinking alcohol. There's going to be people who just can't do the thing, or they just can't do the exercise, or whatever it is. And even in chiropractic medicine, I see that. I can't sit there and watch people day to day and check in. I have 300 people to do, right? per week. I'll check in, I see them often, which is great, but there's a lot of time in between, you know, because I don't want people to live in my office. So I try to make sure that they have enough at home to try to take care of themselves. And the integration that we do, where you are kind of like, you're a coach, right? You're almost like a health mentor, where you have the knowledge of different disease processes, the struggles that those patients are going to, you can predict what things they're going to struggle with, and come prepared with different solutions for them and guide them. So they don't get stuck at home and then come into me with the next time they see me and then end up being behind. And then we have to go back again and start from like, you know, it's like 2 steps forward, 1 step back. I would rather have somebody holding their hand, making sure if they're going to take that 1 step back, that they get pulled another step forward. So that's where the integration between us is really, it's golden, you know. I'm absolutely blessed to be able to like offer this to my patients as part of the treatment plan.
Awesome. And I'm so excited. Like Dr. Jen worded it beautifully. I think it's such a beautiful bridge that I'm able to kind of just like enter in and then make it just a little piece of the whole puzzle together, right? Because there's so many different layers when it comes to like getting a diagnosis. Like you have to do this, take this supplement, change your lifestyle, and changing even one part of your lifestyle is hard, let alone like 10 to 15 elements, and what you eat every day, what you drink every day. So again, that's where coaching comes in. I also really love to focus on like mindfulness with my patients and working on like breath work and meditation, because I find that if you're able to be really present in the moment and you're able to kind of like control how your mind is, then like the mind takes over the action portion, and the way that you think becomes the way you act. So if you're more present and mindful in your care, you're going to take care of yourself better than if you're just like doing all the things that, you know, Dr. Jen prescribed you to do, but with a scattered mind. Like, I mean, it's probably not going to be very consistent.
I hear you. I mean, I should probably work with you, because I'm really struggling. I just did a video about New Year's resolutions and stuff, and like, man, if I didn't have those like written down in front of me every day, using my habits app and everything, it would be, it can be crazy overwhelming to like remember water if you're a busy person, you know. It's, you know, there's some days, even though I'm like a water bottle queen, that I generally have about 4 water bottles at any point, that I even get through one of them, and that's crazy, you know. And I'm a naturopathic physician, chiropractor. I know what to do, but it's the action, right? And like there's a quote I think that says like dreams or ambition without action is just like complacency. And that's so basically true. That means you can think you want to do all these things, and you can say you're doing them without doing them. You're not going to get to where you want to go, right? Totally So and I think that's great to have somebody to lead the way. I mean, I wish this was around when I ever got diagnosed with stuff, you know, somebody to be like, what are you struggling with? Like, I cannot figure out, I'm in the grocery store, I can't figure this out. Like, what's a good thing? Or can you help me with making this thing, whatever, you know, like making a dish, which is a big part, like, because the diet's so big. Can you give me tips and tricks to drink more water? Like, can you give me tips and tricks to get over my desire to have my cocktail at night, because that's been my habit for so long, you know, to get through to this treatment. Like, I cannot take these supplements. Like, whatever it is, having that person, you know, and to say, like, and I don't deal with mindfulness. That's everybody, all my colleagues, if any of you are watching this, who were in school with me, you all know I will do pap smears, I will draw the blood, I will do a colonic, I will do a prostate exam before I do mindfulness and meditation ever with anybody, and I will delegate that out. So it's great to have that, because it's kind of like all in one. I don't have to be like, well, go to this person for mindfulness and meditation and to really be present in the moment and understand yourself, do the inner work, and then also go to this person to help guide you with the struggles that you're having. You kind of have that all in one, and it is crucial in the holistic treatment to actually do everything whole, right?
Yeah.
Like do the whole thing
Yeah.
holistically, right?
Absolutely. Yep.
So
And something I often find is like it's literally just like the smallest root thing, but once you like get to it, everything else changes.
yeah.
For example, maybe your route to not being successful is you have like an unsupportive partner or support system at home. So you just need somebody that's going to be like your personal cheerleader, your nurse coach that is like, hey, like I'm here for you though, and I want to see you succeed. And you know, Dr. Jen wants to see you succeed. What can we do to make that happen together? So for a lot of people, they just need like that one person to help hold their hand, and maybe they might not have that. I just noticed that that's a very common thing I see, because your environment is so important to your health as well. So just having that system created makes the whole process so much more smooth.
Oh yeah, and like hacks for everybody too. You know, like a lot of us are busy professionals. Like I'm being 100% honest. I make these treatment plans for people, and sometimes I'm like, I frankly don't know if I could do this with my lifestyle. You know, like I'm asking. I know what I'm asking. I'm asking a lot of this person, and usually I end up negotiating, you know, and trying to do it and break up the treatment plan into phases and stuff so that it's. But if we didn't have to do that and we could do just one, like instead of 3 things each phase, if we could do like one more thing because you have an accountability partner, you get better instead of 6 months. You get better in 3, and then by 6 months you're good. You have all the tools. You have more tools than I could give you, and then you're not going to fall back.
Yes,
and
absolutely.
You'll always be available, just like me. If something happens after discharge, you're always available for someone to, you know, schedule with you, even if it's outside of our treatment plan.
Yes.
You know, and that's the beauty as well of our integration is we're 2 businesses. We have 2 separate businesses, but we integrate and we share patients, right?
Absolutely.
So, if say I wanted my mom to get nurse coaching, but she's not going to listen to me for crap, so why would she come to me? I would just send her to you, and it doesn't have to go under. She lives in Ohio, but virtual. It doesn't have to be Illinois insurance or anything like that. You know, and I know you do work with a lot of people, more of a cash patient. Okay. But yeah, and I think that's great too, because I would hate for somebody to have to go through me and like almost like I'm gatekeeping, you know, and that's not the case. Right. So and that's another beauty of our relationship as well.
I think so too. I also think something that's important to mention, to disclaim, coaching does not replace like therapy or counseling.
True. That's a good point.
So I love to say that because I've worked with a lot of clients that said like, oh, you know, like, do I not have to see a therapist now? Are you able to fill that void? Definitely not. I can't diagnose. I can't prescribe. As a nurse coach, I can't do either of those things. So when it comes to different parts of your health in those senses, I might even refer you, you know, to somebody that can help you in that department. So a coach doesn't, you know, do all of it. So
yeah, no, that's a great clarification, and I think that needs to be made because there's a confusion. It's like an overlap where people are like, this feels like therapy, but it's very scope wise is very limited, and that's due to the state and not due to what you're capable of doing.
Correct.
Right.
Correct.
But you know, we as friends and as colleagues, you know, now we communicate very frequently. So if there was a need for more interventions, we can reach out to like my network as well. You have your own network, so whatever, it would work out for the patient. But I just really thought that it was crucial to try and introduce you to the public, so that I just don't want my patients to, because it's such a new thing, and you had to teach me about it.
Yes.
And I was like, that's amazing, but I was like, but what is it? You
Yes.
know?
Oh yeah.
Like it sounds cool, but what do you do? And the name isn't self-explanatory, right? Yeah. So I really think that introducing you to the patient so that when their treatment plan passes your desk, right? And then you get to see them, that they've already met you. They've kind of got a little bit of FaceTime with you through this, and maybe even got a little bit of FaceTime with me to see how, when we do integrations, we work together. So yeah.
Well, I'm really excited. It's also really exciting because, like Dr. Jen said, nurse coaching is definitely a new field, but I think that in the next 5 years, mark my words now, it's going to be like the hot topic. Everyone's going to want to hire a coach. Doctors are going to want to integrate a nurse coach into their practice just because the outcomes are better and it reduces burnout on the doctor, and the patients are more happy, so
Yeah.
it's a great thing.
Yeah, and honestly, anybody who needs accountability, which is everybody in medicine, you know, is going to benefit from this.
Oh yeah,
you know,
absolutely.
So I'm
Absolutely.
excited to see where it goes. You know, now
I'm
that more
so
people get involved in nurse
Yes.
coaching and see how things are. So the future.
Yeah, it's the future of medicine. I'm telling you guys this right now. It's the future of medicine.
Seriously. Hey, I said that about naturopathic medicine like 10 years ago, and now it's like there's a bajillion of us all over the place, even in states that don't have licensing.
Yeah.
So I was like, this is really cool. How can you not like this? This is good. This is the good.
No, it's amazing. I think our society is slowly changing gears. Like, can I do this in a natural way first before I go to medical intervention?
Yes.
I think that alone is like a great first step.
Yeah. And there's more integration too between, you know, conventional medicine and these allied medicines like naturopathic, chiropractic, where we're beginning to understand how we flow together and how we work together. You know, so you know before you stepped in here, we were talking about potentially doing like blood draws and IV therapies here in the future, and you know the need for like a cosigner and stuff like that. And it's one of those things where I totally understand that is like not my scope. I was not taught that, and there's a time to delegate and there's not. But there's also like, as much as there's a time that's like above my level, my grade as a physician and understanding and more skill level, there's also for other doctors that are learning, like, you know, before the scalpel, maybe we try a couple different things. And then see where it goes, and like to be a little patient. Because then maybe that patient will, you know, get better outcomes.
Absolutely.
You know? Absolutely. So I really think the future of medicine is going in a great direction. You know,
me too.
And I love that they're scooping nurses in to be able to like have a little bit more of that holistic one-on-one kind of you know interaction with patients. Because like I said, even when you graduated, I was like, how is she going to do that? She's so caring, and she's so like personal with these people. How is she going to just 1, 2, 3, 4? You know, and it's like, I get it.
I got a little bit numb.
Dude.
Actually a lot bit numb
how do you
to a lot of it. So I'm excited to reignite that passion of just like the full one-on-one care. Because when you take care of so many people at once and just have orders coming in after orders, you almost are just like in autopilot mode at that point, and you kind of take the humanness out of care, but coaching puts that human side back in.
Well, and you've also seen like a lot, so I know that if I threw you anything when I was talking to you about what you do, I honestly was like, have you seen this? She's like, oh yeah, blah 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 blah, we do this, I've seen this many of these. I was like, that's amazing, because those are all, I just threw you like a bunch of rare disease patients, and you have familiarity because of the experience you had. As much as it became not your cup of tea, very vital and very crucial to like where you are now. You kind of have that level above.
And I think it's kind of important to understand the system before you get out of it, because then you can tell other, you know, patients work with clients in this case, like, I know exactly what that is like. I worked in it, you know, I've worked directly one-on-one with patients in this setting. So I can really empathize with you, you know, experiencing this, but let's see how it could look like on the flip side, or with a more holistic plan, like all the changes that can be made. So I think those two sides are very important.
And you do understand where there's a need for like more holistic care, but then also when you're like, please go get fluids, or please go to urgent care, you know,
totally
please like stop trying to take vitamins for this, you know. And I'm on that same plane, so I think that's also another reason why we work really well together.
Absolutely. It's like an 80-20. Like, I work in trauma, so if someone comes into MVC, like, they don't need oils. They need morphine. So there's always that, like, you know, that need. And I think just, again, having experience with both just makes both of us more well-rounded. And having that experience also makes us more empathetic to different types of needs within that.
Absolutely. So, I had, I think one last question. Can you kind of like walk us through what it would look like to meet with you? So, when a patient comes in, and I make that diagnosis and incorporate you as part of the treatment plan, I send that patient, what are they to expect?
Yeah, definitely. So if someone were to come to me through Dr. John and needs that accountability in their care, I would definitely start with like introducing like myself and what I do, right? But also from there, kind of talking about like what is the one thing that we could talk about that could support you the most within this hour. Like if there's one thing that you are struggling with the most this week, or this month, or just today, what is one thing? Because I noticed the smaller you break things down, the easier it becomes manageable for people you work with. So I love to start with identifying one root cause of a struggle, and then from there, moving into some like mindfulness around that struggle, asking someone what their experience is with mindfulness, and seeing how they can incorporate a little bit of that daily to help, to help with that kind of like root cause. So for example, let's say somebody's, one thing that they're struggling with is time management. So maybe something we talk about is, okay, well, how are you utilizing your time now? What are you prioritizing? Do you have a good support system to check in with about these things? Like what's kind of, the hold up. From there, going into something like, okay, teaching about time blocking and how time blocking is a really awesome way to manage like multiple different tasks or multiple different parts of your care plan. So maybe for them, they're a color type of person, right? They love to see things visually. So I could help lay them out like a one-on-one specific treatment plan, color-coded wise, how every single day they're going to do the bare minimum tasks of what they need to get their care done. Anything extra, they can add extra things in there, but at least they're getting the bare minimum every single day without like feeling overwhelmed. And then getting that check-in from me one-on-one, like, hey, how are things going? Have you checked this off the list yet? Things of that nature. So really asking them like what they would need from me too, like what sort of support are they not receiving that they would like to see from me. So again, very like, it's very customizable and organic.
Yeah.
So I think that's the best part about what I do is it's so organic, it's so personalized. And I also really enjoy, just kind of like listening, like hearing somebody's story, like what happened before the treatment plan, what happened before the diagnosis, like what sorts of things were you going through in your life? Because a lot of the times we forget like, okay, every human has their own story, and maybe like they had a crazy life event or somebody passed away and they're dealing with that. And maybe because they aren't dealing with that, their care plan becomes more difficult. So again, just really getting to know everyone as an individual person, seeing what the root causes are, and then coming up with like one tiny action, step in the right direction, and then from there we can build on. But if we can't start small, unfortunately we can't start anywhere at all.
Yeah.
I also
you're not gonna like leap mountains.
Yeah.
And if you try, you're just gonna fall backwards
Yeah.
and fall all the way back down. It's gonna be a much more painful fall than it would be to just climb slowly.
Totally, yeah. You said it perfectly. And I think for a lot of people, what's really overwhelming is just starting that first step. And then once they get to that first step, a lot of people already know what they need to do. They just needed to get to that first step. Like, for how many of us does it take like weeks? I know for myself, just to do one step towards what I need to do, like it'll take me weeks. But then once I'm there, I can get the ball rolling. So having a coach just makes that ball rolling process super smooth.
Yeah, absolutely.
Mm-hmm.
And listen, we're all human. We've both just shared that we struggle with our own
All
stuff.
the time.
So we do know and we do understand like how to kind of created our own hacks, and
Yes.
like, we know how to work around triggers, and we know how to help people with struggles and preferences and all that kind of stuff.
Yeah.
I just don't have the time, and I don't have the training to do it at the extent that Julia has. So
Well, and speaking of a struggle too, specifically at this point in my practice, I'm working with just women. Because of that, exactly what Dr. Jen said, I think I just really understand women better as a woman, right?
I mean, it makes sense.
I mean, like even going to a PCP, like I try to always get a female doctor just because I feel that, like women understand each other. And so I think it's great too in coaching, like when I coach other women, just having that mutual.
And female identifying as well?
Yes, and
Okay.
female identifying
Okay.
as well. Yes.
Sure.
Yeah.
Awesome. And that makes sense.
Yeah.
I mean, because you're getting into the nitty gritty, you're really going deep on inner work
Yes.
stuff. And so, that's not, you don't want to like go into the woods, into
No.
something like that when you don't understand it. you know?
Correct.
And there's enough men out there.
Yep.
There's more than enough men out there that want to help other men
Yes.
with their inner work and stuff,
There are.
So, but, I think women, it's a different flavor.
It is.
So I think that is very important.
Totally.
And in my specialties, I do treat a lot of men, but at the same time, and a lot of identifying, like, people who identify as female.
Yeah.
And but I do treat a lot of women just because of the nature of my specialties.
Yeah, totally,
so
totally.
that it works out really, really well, you know.
Yes.
And do you do all age ranges?
I do.
Okay.
Yeah.
So like, would you be willing to like? Do you? I guess. Do you and have you worked with like, you know, pediatrics all the way to, you know, talking about like older geriatric women?
Yeah.
Right?
So in terms of medical care, I've worked with the whole
Everything.
age population, but in terms of coaching, right now I've only worked with 18 and up. But I would be willing to coach like preteens as well, especially like girls, because at that time you have social
Yes.
media, you have blah blah blah, the internet,
Hormones.
hormones, bullies,
Yes.
trying to identify yourself, and you're all
Yes.
like, you know, kind of awkward in that stage. And I can really like relate and see myself in a lot of those girls. So I would definitely be open to coaching like preteen girls as
Okay.
well.
Like as long as they had like
Parental consent.
Yes.
Mhm.
Awesome.
Yeah.
Great. Well, I'm so glad that you came, and I'm so glad that we're able to introduce Julia as part of the team and part of one of our community members. And if you are interested in naturopathic medicine through me and my team, which you'll meet the other members in other videos, you will pass by Julia. She's going to be a crucial part in your care. So just thought I'd introduce her, and we're so glad to have you be part of the team.
Yes. Thank you, Dr. John.
Absolutely,
Thank you guys
absolutely.
for watching.
Yeah.